Suddenly, the world I used to know, I see it differently. You woke me from a dream, now here's reality.
Welcome to another episode of Asking for a Friend. Today we are talking all about women's health, vaginal wellness, and just vaginas. Let's just be real, right? And it's a really important topic, and we know a lot of our friends ask us about it. We all have questions about it. So we're going to dive in. We have the most amazing supporting people today. We have Courtney here. She has over a decade of urogynecology experience, and we're fortunate enough to have her on our functional team now. So now she's a functional women's health, sexual wellness, and fertility specialist. So welcome to your first
Thank
podcast.
you. Thanks,
we're
Karen.
excited to have you.
I'm excited to be here.
And then I have the old has-been over here. Who needs no introduction, but I will because, you know, I have to, unfortunately. Dr. Weston.
Way to make a girl feel special.
Dr. Weston, she is our resident functional guru, and she is a double board certified doctor in sports medicine and family medicine, has a ton of experience, and now is certified as functional medicine provider, and we're happy to have her.
Thank you for having me.
I love it. And we have a special guest that will come in a little later when that expertise is needed, but currently it is not. So we're going to focus on lady parts and wellness and all the good things. So I kind of want to do this kind of a little bit structured because I know there's a lot we can cover. So kind of let's talk about the issues and kind of what causes them, the symptoms that are involved that women experience, and is there help, and what help is out there for people, and what options do women have? Because I know a lot of women don't like to talk about these things. It's embarrassing, and they're just self-conscious about it. So we can kind of start with a lot of an issue that a lot of women, my friends, face, maybe me a little bit too, but incontinence. So it's something that is, well, even, you don't even have to be older to experience it.
No.
Yeah.
No.
So what causes that? Is it pregnancy? What is it?
Well, there's different kinds of incontinence. So the most common kinds would be like stress urinary incontinence and urge urinary incontinence. Mixed urinary incontinence is kind of a combo of the two. Stress urinary incontinence is more likely after pregnancy, especially after vaginal deliveries. It's caused by typically kind of weakening of the support at the bladder neck. Stress incontinence happens when if you have leakage when you cough, when you laugh, when you sneeze, maybe when you're lifting weights or jumping, running, exercising. And then urge incontinence happens more like, oh, I gotta go. I can't make it to the bathroom. So these are very common. Although it's not normal, it's not, typical aging, although it is common, there's things that we can do about it. And it should always be discussed with your medical provider because there are things you shouldn't have to live with this.
Right. What I want to really know about is so you said go talk to your provider about it.
Yes.
So we kind of talked about your background. So a lot of people may not know urogynecology from gynecology. So what differentiates urogynecology from gynecology?
Yeah. So typical OBGYNs are specializing in women's health care. So we have obstetrics with childbirth, pregnancy, and then gynecology, general women's health. And then urogynecology takes it a step further. They're specializing in things like pelvic organ prolapse, urinary incontinence, urinary tract infections, painful bladder conditions. Those are kind of the bulk of what they deal with. Urinary retention sometimes too.
So when you were in practice, how did you test for it? So what are some of the tests you could do to figure out what type of incontinence, how bad it is, things like that?
Yeah. So we would do things like urodynamic testing for somebody that might come in with urinary incontinence. We can get a lot from a history, if a patient's telling us about what they're experiencing. But urodynamic testing is really helpful to differentiate, and especially if they have something most people come in and they're like, I'm constantly leaking when I'm working out, and this is really affecting my quality of life. I have to wear black pants because I'm embarrassed. We might say, well, let's do some urodynamic testing. Let's kind of figure out.
What do you mean by urodynamic testing?
Sorry.
That's okay.
Yeah. So basically what it is you would backfill a bladder with water.
Okay.
And you make it really full, and then you have a patient go through different things like coughing.
Okay.
And bearing down.
Okay.
It's not something people look forward to, but it's really helpful. And then it can kind of help figure out, is this leakage because of the urethra being a little bit hypermobile? Is it leakage because the urethra is maybe just not quite a tight enough tube, which would be something called intrinsic sphincter deficiency? And there's different treatments for these things.
Okay, so you have a huge background in urogynecology. Now you're in functional. Okay. So how do you treat patients differently as a functional provider versus your straight, urogynecology background? So how is functional different?
Great question. So with functional medicine in general, we like to treat from like the root cause. And we're kind of open to other options. For example, and this is not to say that we, as with a history in urogynecology, like I think doing an exam is so important and knowing what to look for during an exam. Because, one treatment, you can't say Kegel exercises are the right thing because that's not always the right thing. So you want a provider that's kind of proficient in different, in anatomy and things like that. So from functional medicine, like I said, we want to treat from the root cause. We also have other options. We can do, in addition to the typical like treatments for stress incontinence, which might be pelvic floor physical therapy, which might be a continence ring, which might be surgery, like a sling or a bulking injection. We could also consider something like a vaginal laser. We do something called a diva laser that can actually increase collagen and elastin in the vagina that can actually support the bladder neck area and reduce incontinence that way.
I love that because when you were just speaking, full disclosure, you are like, I'm the quintessential victim of this. I used to go to the gym and you guys know what a Roman chair abdominal crunch is. Every time I did them, that happened to me. And it would be on the list. I did CrossFit and it would be on the list. I'd be, oh my gosh. And I would wear black leggings every time just in case. It's very true. It's like a real thing.
Yes.
And 100,000,000% I did our Diva laser.
Yes.
Transformative.
It's incredible.
They recommend a series of 3, which is amazing. Literally after my first one, I couldn't believe the difference. Was not an issue. And I know it's not necessarily for that. I just happen to have like that as a really positive side effect from it.
Yeah.
And the other thing I could never do is hold it.
Yeah.
I would be like, if I would go on a road trip, I'm like, I gotta go, pull off. I was constantly pulling over. And it registered with me. We were driving to Florida and I was just driving along and nobody ever had to stop for me. It was like the kids or whatever. But I was like, oh my gosh, I didn't make you guys stop one time. And I could tell everything was just better, in general. So it 1,000,000% works.
It's amazing. It works. Like you said, even just after 1, we know that people get like much better after 3, but even after 1, there's a noticeable difference. And even I've had so many patients tell me even like their partners noticed a difference even after 1.
So what does the Diva laser do?
Good question. So the Diva laser, so it's a hybrid fractional laser. If anybody knows about like halo lasers, we offer that as well, like for the face as like a rejuvenative option. It's similar technology. So it's a hybrid fractional laser, but it works in the vagina. So it's going to target like the deep tissues of the vagina, but also the more superficial tissues. And it's automated, which differentiates it from other vaginal lasers. So you don't have like user error where you're spending too much time lasering part of the vagina. It's very automated, which in my opinion makes it safer. But it can increase lubrication. It can decrease vaginal laxity, making things tighter, which I absolutely hate to say about a vagina, but I have so many patients that come talking about this.
That's what they talk about.
That's what they talk about. But it can also reduce stress urinary incontinence. It can even decrease pain, especially I've had patients that have had like pain after like delivery and scar tissue, things like that. And something that's a little bit like, in my opinion, special about the Diva is that it can treat the entire vaginal area, or you can kind of target part of the vagina, which is really nice too.
I love how we are different from other places that offer those things because we have such an expert staff. Like most people don't have somebody with all your experience in urogynecology, and you do like always do an exam because you want to make sure it's not a cookie cutter thing. And if everyone doesn't need it, they may need something else, and we're going to actually treat the person and where they're at and what they need properly. And I love that we do that.
Yes.
I became a believer in the Diva. So you're a doctor, you're a PA, so you'll appreciate this. But when I first started here about 8 years ago now, I went to a talk with our plastic surgeon, about the Diva, and it was a urogynecologist who came to speak. And it was really interesting because he dealt with a lot of patients who went through chemotherapy, which also causes a lot of dryness and it's awful. And he would, I don't know what the protocol would have been, but he was always sending tissue samples to a lab, and he made it mandatory that all of his patients did a series of 3. It was just kind of his thing. And he did that because he became a believer when he was sending the tissue off. and it would be like, tissue that of a 75-year-old female, whatever.
Yeah.
And then they would do the series, and he'd get the tissue back that he would just send off, not for diva purposes.
No.
This was just general tissue he's sending off.
Yeah.
And it would come back, tissue that of a 58-year-old female. And he was like, oh my gosh. And it makes sense because we do Halo, same technology on our faces, and we notice such a huge difference. And it's just building collagen production. It's resurfacing your vagina, just like you do your faces.
Yeah. I mean,
women do that all the time.
Exactly.
And why not treat that, which is just as important as this, the same way?
There are histological changes that we can see after the diva, which is incredible.
It's crazy.
Yes.
It really, really works.
What's recovery time?
It's really easy. It's so much easier, especially compared to other types of vaginal lasers. So not only that, but it's also like quicker. I mean, it's like less than 6 minutes and you're done.
The numbing is longer than
the numbing is longer than the actual treatment because we want it to be comfortable.
Yeah.
But recovery, I mean, I mean, and I'm extra conservative. I'm like, let's just abstain from intercourse for like 5 days. But I mean, it's not painful. I mean, there can be a little bit of discomfort during the procedure, but it's so minimal. I mean, I just saw a patient recently, and I always ask patients, rate it from like 1 to 10 on a scale on a pain scale. This woman said it was a 1. I was like, after the numbing, but still, it's comfortable, it's quick. And then, other than that, you could expect maybe a little tiny bit of spotting, maybe a little bit of cramping. And if that happens, you could do a little bit of ibuprofen. But overall, the recovery is so quick, so easy.
One of my girlfriends had it done.
Yes.
She said it felt like a little man was in there, like a little minor, and it was just like
So true.
Right.
And it's like
when I said that to other people who've had it, they're like, yeah, it's just like that.
That's
I'm like,
exactly what it is.
And you don't even notice it. The only time I did is as like it got kind of near like the
Opening the vaginal intratus?
No, there, and then it like probably near the cervix
Oh,
more.
okay.
Because probably the numbing doesn't quite make it there, but that other than that, and that's seconds. Of so it's totally worth it.
Yeah.
I love that. Yeah. What else I know women deal with a lot of other things. So we're talking about like dryness.
Yes.
Diva helps with that.
And it's nice because, I mean, in the functional world, we do use a lot of hormones, and a lot of women are candidates for hormones. There are some women that are not ideal candidates for hormone, but the Diva's awesome to help with dryness. Like if somebody's going through chemotherapy for cancer, something like that, who might not, if they have like an estrogen sensitive cancer, that might not be a candidate for estrogen therapy to help. The Diva's fantastic to help them. I mean, when you have that atrophy, from a lack of estrogen, your skin is thin, it can burn, it's painful, dry. The Diva is a wonderful option that doesn't include hormones for those patients.
So you mentioned the vaginal estrogen, right? So that's a hot topic.
And that can help there's some research that shows it can help with some frequency and urgency.
Absolutely. Oh, interesting. Mm-hmm. Really? Is it just like a suppository or what is it?
Well, you can do multiple different ways. So you can do suppository, you can do like that you literally put it in a syringe and squirt it up there. You can do, there's also tabs that you can put in there.
Interesting.
You can do a vaginal ring and put that in there.
And what are all the benefits of
it is, so when, let's just make this difference because you can have moisture issues, but then you can have atrophy issues. So like,
can you tell the common person what's atrophy?
Yeah. So atrophy is like the thinning of the skin.
Okay. So it's just like your face skin as you age.
Yeah.
Gets thinner.
It's like crazy.
You lose collagen.
That happens down there too.
Okay. Great. That's awesome.
Aren't you glad you listened today? So you can have, and those are different, but vaginal estrogen can help with both. But like those are the people that it's atrophy if they're like, I'll hear patients in the office and they say, I'm using lube. But it's just wet knives.
Yeah.
And I'm like, so it's still painful. It's just not dry. Mm-hmm. So, but it can help with that atrophy. So it can help with thickening up that mucosa.
Interesting.
And then also just as an aside, it can also help with urinary tract infections.
Mm-hmm.
So women, as we get older, you're more prone to having urinary tract
so
infections. So
preventatively help or
Correct.
as a
Preventative.
or like, okay.
Yeah. So preventatively.
Okay.
So, I mean, not to get totally off topic, but if you look at urinary tract
we're
infections.
going to talk about UTIs. So.
Well, it's actually a really common reason that older people end up in the hospital. And very commonly it'll start with a urinary tract infection. The bacteria gets in the blood and you end up with something called sepsis. And a lot of people can die from that. And so just doing vaginal estrogen is super helpful for that.
Interesting. So I know a lot of women, actually all ages, I just think some are more prone to UTIs. And I saw something that it could be hormone related. Is that possible? Or were they talking more that hormone would help prevent it?
Yes.
Okay.
Correct.
Because I just misheard. But
Well, because the thing is, when you do have that dryness and that thinning of that mucous membrane, it changes your vaginal pH. It changes your bacteria, your healthy bacteria that is in your vagina. So that lends itself also to urinary tract infections.
Interesting, because all ages I feel like have them. So all of the women that I know, and I know a lot that have reoccurring UTIs, possibly vaginal estrogen is a great preventative thing for them to do.
And it's also super safe to try. Anyone can use vaginal estrogen.
Yes.
Even those who have cancer, and you have to get it approved with your oncologist.
Right.
There are no studies that show that vaginal estrogen increases risk of even gynecologic cancers.
Interesting. So you were talking about it like regenerating almost a little bit, like helping with thickening and stuff like that. So it's kind of like the whole craze with it on your face. Like it just helps. Oh, interesting. So we're just like totally treating this the same in a way. I love that.
I mean,
I love that.
we get all these changes because we're low in estrogen.
Yeah, that's awesome for us. So happy about it. But you brought up something because that's another thing that I know women deal with. Actually, a couple things. We'll start with one because I know they're separate. You talked about bacteria. So let's talk about like BV, which is
Bacterial vaginosis.
okay. What causes that? Like, what do women do about it? I've heard so many things. I've heard apple cider vinegar. I've heard coconut oil. I've heard, because I know the three of us tend to try to be more holistic in how we treat things and everything.
Yeah.
So like what causes that and what can women do to prevent it, or when they
knew.
get it, what they can do? I mean, obviously you have medications, but outside of medications, maybe that can help.
So it's a change in the vaginal pH that allows that bacteria to grow. And we don't really, we know that's what causes it, but we don't always know what causes the pH change because some women are very prone to it. And some women, it is very hard to get rid of. And it's not really dangerous unless you're pregnant. If you're pregnant, we treat. But otherwise, you don't have to treat it. It's more, honestly, because it's a little smelly. That's why people usually come in. Smelly discharge is why they come in.
Yeah.
But so usually use metronidazole to treat it.
And what's that?
It's a
antibiotic?
pill. Yeah.
Oh, okay.
And so if you don't want to, other things I've used. So there's a suppository called Refresh, and that can help change the pH.
Is that boric acid? I've heard
Sometimes I'll
about
use
boric
that.
acid.
No, that's different.
Okay.
I've also used boric acid. That can be compounded at a compounding pharmacy. And I've had some good luck with it, but honestly, there's no silver bullet that's going to treat. So you do have to, it's a lot of trial and error. And some people, I mean, I don't know if you've had great luck getting rid of the chronic cases. They're really hard.
They're really hard. I think kind of bringing it back to just the root cause medicine, working on gut health too is so important when we're thinking of gut health is not just stomach symptoms, but also when we're thinking of bladder, when we're thinking of vaginal health, this is all, it all plays a role,
How
the
does it
tubes
play a
are
role?
all
So how does gut
real close down there.
I know, how does
together.
gut health play a role? And we'll start there. How does gut health play a role?
I mean, gut health plays a role with all kinds of things, whether it be female organs, whether it's even brain, whether it's neurotransmitters, things like that. It's all so connected to the gut. There was, I don't even know who said it, but from a functional medicine standpoint, when in doubt, look at the gut or treat the gut is kind of a saying. But, we want to increase, our good bacteria of the vagina, because when we get BV, it's kind of an overgrowth of bad bacteria, and we want to promote the good, healthy bacteria. A lot of really healthy lactobacillus strains. They even have, even using probiotics orally or even vaginally.
There's vaginal
There are
probiotics?
even vaginal probiotics.
Interesting.
Yes.
I did not know this.
Yes.
So I know probiotics are huge, and I know a lot of women who struggle with that took probiotics, and it really, really helped. They didn't struggle with it anymore. And they took it prophylactically. Is that right? And so I do know that helps a lot. Is there a specific probiotic you would look for? Because I know there's women's probiotics or vaginal health probiotics, and there's just probiotics. Does it really matter? Is there a certain strain of bacteria you want in there for the vagina versus your gut or something else? What's the difference? Is there one?
Lactobacillus.
Okay.
There's multiple strains of lactobacillus that are really
So
helpful.
that's what you just need to look for.
That's one
Yeah,
of the
there's
names.
yeah. There's another one, Ray.
Yeah.
Ram
Starts with an
something.
R.
Yeah, it's
yeah,
an
like
R.
6 letters.
Yes.
Ram, okay.
Ram,
Well, that's
Ram,
6 letters is short for that.
It's a short one.
It's not
It's a short
super
one.
long.
Okay.
It's a
Yes.
short one. My mind's blanking on
I've
what it's called.
got it on my phone. I've got a screenshot.
I
Yeah,
love
but
it.
you can get that strain will be in any
Vaginal.
female vaginal
Okay.
like probiotic. Anything you find that's pro-female probiotic,
Yes.
it'll have that strain in it. There's tons of research on
I
it.
love that. Okay. And then the next thing I was going to bring up, which is another sore point for women, are yeast infections. So fun. Let's talk about them. Like, what causes them? Is there anything you can do to prevent them? What do you do? Like,
So we probably should say, so we're probably skipping over some like very easy things for BV and yeast infections because a lot of times, or in chronic UTIs, so a lot of times that'll happen after sex. So like hygiene-wise, you know, going to the bathroom after sex or using one of those, I'll have my patients do those flushable wipes. Also, like if you work out and you're going to want to take your nasty spandex off and don't be sitting in it all day.
Yeah.
Like those kinds of simple things, I don't want to overlook
They
that
are
stuff
important, yeah.
because they are important.
Wiping front to back.
Right.
Always important.
we learned that early.
Early on.
We learned that early.
Hopefully.
So I want to touch on that because the wipe thing, those are,
Yeah.
so there's two things that are a craze right now. The wipes, so you say they're okay, but are there
just-
certain ones you should avoid or
I just get the it's pretty much water on a
water on a
cotton
like the
thing.
water wipes used for
Yeah.
the kids.
Yeah.
And then the huge thing now is the body deodorant that you use down there on your feet and your underarms,
Yeah,
like everywhere under your
They market it
boobs.
everywhere.
Adeline
Like-
asked me for it.
Yeah.
I was like, what? You're 12.
Is that like, should you be putting that down there? Because I've always kind of had the mindset of the more you do, kind of the worse things can be. So just kind of like it's very naturally cleaning area. Just kind of let nature handle things and don't try to mess with your pH. Is that right? Or do you think that some of them are good?
I wouldn't spray any body deodorant.
I
Anything
wouldn't
you can
spray.
spray on
Okay.
your armpits, let's not spray also in your
Okay.
vagina.
And yeah, washing water, like a non-scented, mild soap
Okay.
is good. You know, on the outside, typically, you don't really, I don't think douching is not necessary. It can actually like disrupt pH. It can disrupt like the good
Interesting.
bacteria we have.
Okay.
And can lead to other complications like during pregnancy, things like that.
Is douching ever okay?
It's just not, it's kind of,
Yeah. Okay. I've always heard that, but I
Necessary, yeah.
never have asked anyone professionally
Yeah?
if it is. So
I've never
Interesting.
ever heard a physician or any provider say douche.
No.
Interesting. Okay. I love it. What about,
I mean, we didn't finish. So yeast infections.
Oh, yeast infections. Sorry, we got sidetracked on all the other
Coming back.
cleansing.
Coming back around. So gut health is also important. And with gut health, we test for yeast when we do stool testing.
Okay.
So, and then you can there's multiple different lifestyle changes you can make. So can you use medication? You can. But usually we'll do, a yeast-friendly diet, which no one loves it because it's no sugar and it's no white things.
hard, but it
can make a
does help.
huge difference.
It makes a huge difference.
Yeah. I mean, I've had people go on a anti-yeast diet and it's like candida is what it's called, but and like their toenails will clear. And they're like, it's the weirdest thing. I'm like, it's actually not.
We're
It's
getting
all-
rid of yeast. Yeah, it's
So true.
connected.
Your body's going to get rid of it somehow, So that's interesting. And did we touch on like what to do treatment wise for yeast?
yeast. I would do lifestyle.
Just lifestyle. You don't recommend like the suppository, like the monostats and all that kind of stuff that you get over the counter?
Okay, so I realize I'm functional and
I know.
yes, let's do everything natural if we can. But if I can take one pill one time to get rid of my yeast infection, I'm going to choose
do it.
that.
Yeah.
Personally.
Yeah.
Yes.
I love it. I also want to ask this really quickly, just because so I don't know. I feel like a lot of women will feel like a UTI coming on and like say, I know it's coming. What, in your expert opinion, should a woman do because it's the worst. As soon as you feel like you're getting one, what is your go-to to say, do this and it should help, like just make it go away as soon as you feel the symptom?
I mean, I'm big on like hydration is really important.
Right.
I'm big on reducing like bladder irritants. So like alcohol, caffeine, like acidic things, artificial sweeteners. We can use things like methenamine to avoid recurrent urinary tract infections.
What's
which
that?
It's It's a medication that can
Okay.
actually be used, like rather than using, if somebody has these recurrent UTIs, rather than using like antibiotics, like recurrent or antibiotic prophylaxis, you can use something like methenamine, which kind of helps to, it's not an antibiotic, but it is an antiseptic.
Okay.
And it can kind of help avoid those. It's almost as effective as antibiotics every day.
Interesting.
So
What about the cranberry juice myth?
So I
it does
will
help.
do cranberry.
Okay.
Yeah,
Okay.
and studies show, I mean, there
Yeah.
are studies that support that.
Interesting.
And the other one I'll use is D-mannose.
What's that?
D-mannose. What is D-mannose?
It's a sugar, and
Yeah.
so the idea is that it kind of mimics like the cells of the bladder wall. So the uropathogens, the bacteria, kind of adhere to that, and that you kind of pee it out instead of.
Where do you
allow
get
them.
something like that?
You can get
It's
that
so
over,
normal.
yeah.
D-mannose?
Yeah.
Like,
you can go up pretty high on dose. for
and where do you get
D-mannose.
it? Is it a
Like
prescription?
no,
No,
like a
no,
health
it's a
store
supplement.
Oh,
or
interesting.
Even
Yep.
Kroger.
So is it like with supplements or like, oh,
Yep.
wow.
Yeah.
Okay. Good to know. I will definitely
Oh,
keep a stock of that.
and on that note, if you do think you're having urinary tract infections, it is really important that you actually are tested for urinary tract infections. So there are things that can masquerade as urinary tract infections. One being interstitial cystitis, which we call IC. The symptoms are identical to a bladder infection, and that's why like going to urgent cares or just calling your doctor and asking for it. Like it's really important that you actually are checked because treatment is completely
so
different.
Yeah.
And really, IC patients, I think, should see functional and
Oh,
have a gut
absolutely.
health. Yeah,
100%.
gut health workup. So just
Absolutely.
Interesting.
And if you don't get that culture, you're kind of delaying treatment. You know, if you're presenting with all these same symptoms, negative culture over and over, that's kind of like one of the top things we think about.
Interesting. I love that. And we have an amazing Colleen, who's our gut guru at the
amazing.
office. And I know she has an amazing, like a very targeted program that she offers. And I know several people who have gone through it and it has been completely life-changing for them. So she does an amazing job. That's really interesting though. I would never have gone to my gut health
Right.
for these
Like
issues.
my bladder, but
Yeah,
gut,
a
yeah.
1,000,000%. But that's
Absolutely.
really helpful. Let's go on to libido. So I know we've done at least one podcast where we talked a lot about it, but it is a thing and it's important. And, we shouldn't dance around it. And I know women, especially as they get older, struggle with it. I think, a little bit different parts of their life, they struggle with it, but especially as you age. So what causes that issue and, how can you guys help?
there's a lot of different things that affect libido.
Yeah.
And this can be a really sensitive topic for patients. So we just have to be careful how we're talking
We'll just take
about
a drink
it.
as we
Yeah.
Well,
absolutely.
which that's not helpful for, okay.
True. Alcohol is not
helpful. So anyway, when I'm talking to patients, I'm like, listen, because usually people come in and they're like, I want to go on testosterone or I want to do the new medication I heard about for libido. And I'm like, okay, but if that's the problem, it can be helpful, but there are a multitude of other things. So is it that you are so stressed that it's not on your top 10 to-do list for that day? Is it that you can't turn your brain off? So you're literally like having sex, looking on your nightstand and you're like, oh my gosh, I need to dust. Or you're thinking like, I'm gonna have to wash these sheets. Like it's hard to get in the mood if you're thinking about the cleanup.
Yeah, the mental load that women carry.
these are clean
a lot.
sheets.
Right. I'm like, dang it, could you have not tried this yesterday? I just
Can we not tonight? I just changed the bed. Can we at
Can
least
we
wait
move
a
it
week?
to the bathroom or pick another place?
It's so true. It's so true. And women is so much here.
It
It's
is.
crazy.
Yes.
It's crazy.
Also, I think women sometimes, and I don't know if people are getting mad about it, but sometimes have an unrealistic expectation of what they think should be happening. Like, I will often say men can just have a breeze come by and they'll get aroused.
Yes.
And that usually is not the case for women, but women will want that.
Yes.
Mostly because we're all in a hurry, right? I don't have time for this. Like, it's true. Okay, we haven't had it in this many days. I guess it's time. Let's get this done. Check that box. But it doesn't work like that for many reasons. And so I think when I first learned, and we've talked about this before, when I first learned that the vagina is like 3.5 inches long and a normal erect penis is like 5 and some change. In order to have non-painful sex, you have to go through foreplay and let the vagina lengthen, and it can double.
Did not even know this was a thing.
So when women are like, oh, I feel, and then you can feel it hitting your cervix sometimes and it's painful. I'm like, is it painful because we rushed this?
The
You can't just jam it in there.
No,
I mean, you can try.
No, you're right. I mean, the arousal process is important.
Yes.
The lengthening and the blood flow and swelling, all those
Yep.
things are really important for like enjoying it.
And for orgasm,
And
right?
for orgasm.
Yep.
I mean, and like to what Dr. Weston was referring to, like there's such a mismatch. Like with men, it's like 80% of men have more of like a spontaneous desire. In women, like 80% it's more of a responsive desire. So with men, they get the feeling like, ooh, like Dr. Weston said, ooh, that wind feels like okay,
let's do it.
I'm ready. And a woman, it's like, no, like I need to let's get things started. Like that's normal for women. They're more responsive. So that communication too is so important.
Men can have desire first, then arousal, then sex. And women, it's often arousal, then desire.
Exactly.
So that's why when women say, well, once I get into it, then my libido's fine. And I'm like, so it's actually it's not a libido problem then.
No.
Okay.
It's like a scheduling issue.
Right. So like once you're
Or like a relaxation
in the
issue.
moment, as long as you're like into it, then
Yeah.
it's like, okay, it's all the other things that you need to worry about,
You-
not really
most
your
of the time. I don't want to
body.
say blanket statement, but
Yeah.
most of
Yeah.
the time. You know, but I mean, I've had some patients that are like, "Pff, I could be mid-act and exit stage. I'm like, okay, well, that's more of a problem.
That might be
You
a
know?
relationship issue.
Well, so that's the other
another
thing.
thing,
Yeah, we can't
relationships.
ignore. And you will send patients to sex therapy.
Sex therapy is so important for so many, like, I mean, I think almost anybody having sex should be seeing a sex therapist.
I love that.
I mean, truly, like they help with so many things. I mean, in communication, I mean, it's just, there's very frequently like a mismatch with libido.
Yeah.
That's normal. I mean, it's not uncommon. Often, like whether it's the man or the woman, both happen where one person says like, I want to do this every day. And then the other one's like, I'm good like once a month or something like that. But like figuring out like, well, how do we, like, what's the reason?
Yeah.
You know, for men, sometimes they're saying like, this is how I feel intimate. This is how I experience intimacy during sex. And maybe they don't have the words to say that, but maybe that's what's going on.
Yeah.
You know, and women usually want to feel intimacy before they're physically intimate.
For sure.
You know, so it's
Absolutely.
like it's just communicating so
Agree.
that
I totally agree. When you're talking about that makes me think of a book. Like, I think it's the best book for anybody in a relationship is The 5 Love Languages. And it's like, as soon as you know, I feel like once you learn your significant other's love language and you're feeding that, the love tank,
yes,
and you're feeding that, I think like for women, so I feel like the majority of men, their love language, number one, is physical touch. I feel like, and like any man I've ever talked to, that's usually the majority of them. They feel love with the physical touch piece. So that feeds their love tank, right? Yeah. Well, women, it might be acts of service, or it might be words of affirmation, or it might be gifts or whatever.
Yeah.
So guys, PSA, learn your significant other, wife, whoever it is, girlfriend's love language. Fill it all day long, and they're gonna want to do that because women are here.
Yes.
So if they're not feeling loved in other ways, they don't feel like loved that way either. Because it's like, I'm giving you your thing to fill your love tank, but you're not really giving me mine.
Right.
So why would I ever want to do this? You know, so I think that is like a huge thing. And I think it's helped a lot of people understand each other, right? Because it's like different. You think everyone feels love the way you do.
Right.
And that's not the
And
case.
sometimes how you give it and how you receive it.
Yeah, 1,000,000%. A million. And they say to do that with your side
Yes,
notes. Do it
with
with your
your
kids
Yes.
too. Yeah,
Yeah.
which is cool.
I think my kids are gifts. Gifts right now. All they want.
I think mine are too. I had my kids do it, but they're adults, so we did it
I
for
think
fun.
it does change
Yeah.
over
Yeah.
time.
Yeah.
Yeah. My 12-year-olds aren't like, I really need quality time. She's like, I want you to take me to Sephora.
Yeah, exactly. And get some like chemical filled face cream.
whatever's on TikTok.
Yeah, exactly.
Well,
Well,
wait,
go
the
ahead.
other thing too is like some women, so I'll often ask about orgasm because you might not want to have sex if you can't have an orgasm. And like, it's really unfair that men get to do it all the time.
Yeah.
And women don't
Yeah.
really.
Yeah.
And so that's something that needs to be talked about and like learned with your partner
And communicated.
Yeah, and whatever you need to do. And so if you can't have an orgasm, like we'll often use the O shot, right? So I'll let Courtney talk about that.
Yeah. Oh, I'm obsessed with the O shot, the Diva. I think it's so helpful because I mean, a woman will go to their doctor, usually like OBGYN, like, I'm having trouble like orgasming, and there's not a lot in conventional medicine that we do for it.
Have a glass of wine.
Have a glass of wine, relax, take a bath.
There's no Viagra for women.
Yeah, it's like, wait a minute, and that I will definitely want to touch on some medications
let's
that
do
we
it.
can talk about with libido. But with the O shot, so it's really neat because we can actually use a couple of different things. We can use PRP, which is platelet-rich plasma, which is actually, we like draw your blood, we spin it down with a centrifuge to a very small amount to get the really like high quality platelet rich plasma. And then we actually can inject that a few places in the vaginal area. So a couple locations along the front vaginal wall and then also the base of the clitoris. It's a little spicy, but we use numbing, so people do really well. And it's really neat. We either use PRP or we actually even now have something called REScence, which is a platelet-derived growth factor, which actually can contain 1,000 to 300,000 more platelet-derived growth factors than somebody's PRP. So it's pretty neat. It's used off-label for that, but it can also be used to inject in those same locations, and patients can avoid a blood draw. We do both. And it can actually increase blood flow because it something called angiogenesis, or formation of new blood vessels, but also can improve nerve function as well. And when we think of sexual function, nerves, blood flow, those are huge when we're thinking of sexual function. So it can really improve orgasm quality.
Interesting.
Yeah.
What were you going to touch on?
Some medications that are FDA approved for improvement in libido. So they're used for treatment
for women?
For women, for hyposexual desire disorder. It's FDA approved for premenopausal women, but it could be used off-label for postmenopausal women. There's two. So there's one oral medication called Addyi is the brand name. It's an oral pill. You take it at night, every night. Usually takes about like 8 to 12 weeks before we really see an improvement. But then it can really improve desire. It can't be taken like with alcohol. So we'd have to talk to your provider about what do I do if I want to drink that night. But it can really improve desire. And then we also have something called Vyleesi, which is actually like a shot. So it's a subcutaneous shot, like a little auto injector pen. It's really easy. You can use it like once or twice a week, about 45 minutes before scheduled sexual activity. So sometimes you have to think about like, do I want to schedule it or not? So that can be something like I talk about with my patients, like, do you want to schedule it? Do you want it to be like more spontaneous? But for my patients that do want to schedule it, it can be really effective in improving libido. Now that one does sometimes have a little bit of nausea, especially the first time you use it. But I usually tell my patients, we can do a prescription medication to avoid that, or it usually improves by the second injection. It can about 30% of people can experience nausea the first time. That can reduce to about 2% the second injection. So I'm like, let's stick with it. We can use the medication to help it the first time, but it can be really helpful for
Never
libido.
even knew this existed.
Yeah.
Interesting.
Yeah.
Are there any natural supplements, things you can take to help with libido, or?
Well, so also testosterone. If your testosterone is low, you can use testosterone. Or DHEA, which is another male hormone or androgen. DHEA can turn into testosterone, but that's when we use labs and we see if you're low. Some women can feel the change with testosterone pretty quickly in a couple weeks, but normally we want to wait 12 weeks to really see if it's helping or not. So that's another option for people.
Interesting. Are there any, outside of just like hormones and prescriptions, are there any supplements that help or no? Because you hear different things. I don't know if they actually help or not, or the science behind them.
Carrie.
There's one that's called Restella that could be helpful. The thing is, a lot of these studies are done by the company that's selling it, so it's kind of like
no
maybe.
third-party testing.
Yeah, so like usually, and that one usually takes at least like 8 weeks to kind of see. That's where they're really like seeing most of the improvement. I would monitor like blood pressure if I was using that, but that might be something to consider.
Interesting. Well, since we're on the sex topic, I want to bring in, because I know insecurities down there on appearance and things can oftentimes make women a little insecure. And if you're worried about that, then you're not right here. So then you can't relax enough to enjoy. Is there anything you guys want to touch on as far as like issues outside of that before we transition to our special guests, or no?
I think
No.
We covered everything?
Yeah,
We're going to have a little fun
Yeah.
after, but
Yeah.
up until now. Okay, perfect. So let's get Dr. Donaldson. He's in the building.
What's going on?
I love the shirt.
How are we?
We're great.
What is going on
Welcome.
here? Thank
So
you.
for anyone who doesn't know, this is Dr. Donaldson, board certified plastic surgeon at Donaldson. And we focus there on plastic surgery, aesthetics, wellness, functional medicine, and med spa. But he spearheads the organization. You've been in practice how long now?
Well, about 15 years.
About 15 years. I love that. And one of the number one procedures he does, I can attest to this, is labiaplasty.
True.
I started with you almost 8 years ago, didn't even know this was a thing, and I'm a woman, that existed, and you were doing them multiple a week.
Yeah.
So I want women to know out there that struggle with those insecurities of how they're feeling aesthetically in the vaginal area. It's very common. You're not alone, and there is a fix that is pretty quick and easy.
Absolutely.
And I don't want to talk too much about it because you're the expert, so I want you to. So tell us about labiaplasty.
Yeah, I think you guys have talked a lot about, I assume, internal workings of the vagina and desire and sensation and lubrication and atrophy and those things. But I think most patients, their relationship with that part of the body is external. It's what they see, it's what they feel in clothing. And it's what gives most patients the most pause just when they're lacking confidence. And so we can really help because it's a really simple anatomical process and solution for those patients who are really concerned.
What is that? So I know they come into our office. You do there's a couple. They actually have options, which is nice. Yeah. You can do a virtual consultation for a labiaplasty, or you can do a virtual and come in and see you and then do it, or you can just come in person and see you. So you have options on what you want to do. So we have patients from all over the country that will do a virtual, and they can just come in day of and have the procedure done because it's pretty straightforward. Right. So tell me, once they see you, you do an exam and they meet with me, what's that process once they schedule as far as the day of the procedure? Yeah,
so it's really, I think the biggest hurdle is just coming through the door. Patients having enough confidence to say, okay, this bothers me enough, I'm going to actually do something about it. So it takes courage to get to that point. And then once a patient is at that point and they come to our office, they realize how approachable we are and how it's really not as intimidating as they thought. And I think the more they learn about the procedure itself, it even becomes more that way. It's just not a large operation on the scale of things we do. It's relatively straightforward anatomy. We're talking about the external anatomy, which is just extra skin. And I'll tell patients that although it's a very sensitive area, fundamentally, at least in terms of the anatomy, it's like an earlobe or like your elbow skin. It's just not complex in that way. And so to answer your question, patients come in that day for the procedure. They come in a half an hour early. They'll have numbing cream placed. We'll talk to the patient, just make sure we're on the same page. And then my assistant will take them back to the procedure room and we'll drape the patient, but they're awake, which I think is what is really appealing as well. They can drive themselves. You're not burning the whole day recovering from general anesthesia. They'll come to the procedure room. We're listening to music. We're talking about the weekend. It's a pretty low key, non-threatening environment. And at that point, we put a little local anesthetic in just to make sure that the anesthetic cream that we used over the last half hour is really kicked in. At that point, most patients don't even feel it. It's a little needle the width of someone's hair. It's a tiny, and most patients can't feel that, but we double check. And then when everything's just really set and comfortable, we proceed. So it's straightforward and it takes, half an hour at the most.
I love that we do it under local. That's not common. I talked to a lot of patients that it was only offered under general, and having talked to thousands upon thousands of patients for every procedure known to man, including labiaplasty, one of the biggest fears is general anesthesia. So to avoid that obstacle is huge, and just to be numbed. And I have to say this because she doesn't get enough credit, but you're like, and my assistant will take you back and numb you. Can we give Bobby some kudos? So He has the best assistant in the world. She's the office Nona. She's been with you for how many years?
Almost the whole time, 14 years out of 15.
14 years. Yeah. So imagine your Nona there to get you through this procedure. Seriously though, if she you wouldn't want anyone else with you. She's the most comforting, amazing person. Yeah. And I will say the same to you though. Patients will come in, and by the time they see me, they're like, oh my gosh, I feel so much better, Because I think it's just, like you said, the hardest part is walking through the door. Yeah. And once they get through that door from the front desk to you, and then to the procedure day, Bobby, like starting that whole process, it is just a really comforting, like, family atmosphere, and you're just welcome with open arms. And I feel like that's something we're really good at. So I just don't want women to ever be afraid to come and talk about it.
And I think that in the procedure itself, you know, it only takes a half an hour. The sutures are dissolvable. You don't have to worry about coming back and getting stitches out. It's a very forgiving area. I mean, fundamentally, babies come through that area, right? Like, it repairs really, really well. We don't tend to see issues with bleeding or infection. Patients may have spotting for a day or two, but we teach how to take care of it with Tux pads, which are sort of post-pregnancy soothing, witch hazel pads, antibiotic ointment, a little bit of ice pack. But some patients are back to full standing schedules the next day. I don't recommend that. I recommend just kind of taking the day off and probably the weekend off, frankly, just to make sure everything's really comfortable. But then it's, you know, after that kind of feels like a paper cut for a couple of days, and then it really doesn't anymore, and the sutures start to dissolve, and patients are back to work, you know, after that several day period, and then you know, resuming normal activity certainly within a week or so, and full go activity within a few weeks, and back to having sexual intercourse and riding bikes and horses and whatever's putting more stress on that area within a month or so.
I was just going to say, what's the sex verdict? Because we get that question the most. I've had so many husbands will be in there and they're like 4 weeks for sex, and they'll be like, I'm out, honey, you're not doing it. It's so funny. But that's like, it's a big question we get. So
you got to play the long game. You got to
get things healed. It's worth it. A month will go by fast, I promise. And then you'll have a lifetime of, like, you know, drain it. So the other thing I want to touch on, because being in this industry, I, you know, follow a lot of people and I'm aware of a lot of people and a lot of techniques and how everybody does things. And I love the technique you use, and I want you to explain the difference in technique and then why you choose the technique that you do. Sure.
So it used to be, I mean, 20 years ago, certainly 30 years ago, the standard was just called a trim labiaplasty, where basically it's just kind of an amputation of that extra skin. And we're talking about the labia minora, by the way. So if you look at external vaginal or vulvar anatomy, there's labia minora, or the inner lips, and the labia majora, or the outer lips. And so really usually talking about the labia minora here. So surgeons would just cut across it. But the problem was there was kind of this scalloped edge. It was all scar tissue. It didn't really heal. Sometimes there were pigmentation concerns, and so it really didn't heal in a very natural way. And so really over the last decade, if not 2 decades, we've been using a wedge technique, where we're removing a wedge of tissue and then closing that back together. I use what's called a modified wedge technique, or modified V-wedge technique, where we're not even removing the inner soft tissue, the really thin substance inside the labia minora. We're removing the outer exterior skin, both internally and externally, and then closing that together. So it decreases the complication rate, it heals together really naturally. You see natural edge all the way along. There's just a little, usually I illustrate this for patients, but usually there's just a little a hairline scar that most patients can't even see on really close inspection.
No, you can't.
And you don't want to remove it totally. There is a functional component to having that external anatomy. So you want some, but most patients just don't want as much. It's just getting in the way.
What complications could you face, like doing that trim method? Like what are the...
Well, I've seen cases where surgeons have removed too much, you know, cases when surgeons haven't removed enough. So it can be hard to get that balance right. So I think that wedge technique preserves the function, but also improves appearance. And for most patients, it's a combination of both. They're concerned with the way things look, but there's also folding and pinching in certain situations, whether it's intimate situations or more athletic situations, or even the way clothes fit, or tight bathing suits, tight jeans. So the same operation helps with both. And
it can be unilaterally or bilaterally too. Yeah. We've had patients with one side that's just more than the other. What is there a cause for it, or is it just kind of
not really? I think it's genetic. In fact, I've helped patients and they've found relief, and then they tell their sister, they tell their mother, and then that kind of opens a family conversation. And I say, well, we've never talked about this, but I'm look the same way or feel the same way. So we've had families go through this together. There's hypotheses about whether vaginal childbirth can make this worse. But there are also myths. It doesn't matter how much sex you have, you're not going to develop this condition. So,
I love it. Now, once you do have a labiaplasty, can it come back typically, or what's been your?
I've never seen it come back. It tends to be a really durable procedure. patients are really happy. I mean, I think the biggest concern most patients have is it going to be really painful, which it's not. And is it going to disturb sensation? Are we going to get into that clitoral anatomy? Is it going to impact my ability to enjoy orgasm or sex? And the answer is clearly no there as well. If you have a surgeon who has experience and knows the anatomy.
That's funny you say about recovery and patients do really well. I have a friend who had a labiaplasty with you, and literally 3 days later, and nobody do this that's listening, but 3 days later, she was on her Snapchat story or Instagram story running down High Street downtown in a mini skirt and heels. And I was like, you shouldn't be doing that. She was like, I know, but I feel fine or whatever. I was like, okay.
They confide in you. Patients don't tell me that stuff.
I know. She did great though. No
Good.
patients.
Good.
I said, PSA, nobody do that if anybody has one, but just to say like patients do feel really good. To touch on the like clitoral hood part, because that's a question we get a lot. So how does that fall into play with a labiaplasty? Is it part of it? Is it not? Like how do you decide those things?
Yeah, it just depends. So we've been talking about the labia minora. So then if you go up, further, you're kind of in that clitoral hood, the skin that covers the clitoris, and oftentimes it's there's a mild amount of redundancy there that's corrected by the wedge labiaplasty. And so typically I will avoid the clitoral hood just because we do get into further potential concern about the sensation or disruption of that ability to enjoy sex or orgasm. So, but if there's an excess amount of skin, like a true more redundancy of it, then we'll remove it at the time. So the clitoral hood reduction can be combined with a V-wedge labiaplasty. And I'll do that probably 10% of the time. Yeah. The other 90% is corrected with the wedge itself. And then the third area is just the labia majora, or the outer lips. And that's not as common to address either. It just doesn't bother as many patients. Some patients can have true skin excess to the labia majora. Some patients actually just have deflation, volumetric deflation, similar to what you'd see in the cheeks or in the breasts after breastfeeding, something like that. In which case we can use fat transfer. So if there's excess skin, we'll remove that in an external labiaplasty, or we'll do fat transfer and kind of plump that area again. And that's really personal for each patient, depending on kind of what their goals and concerns are and what the underlying anatomic changes have been.
As far as the majora with the excision versus fat transfer, is that something that can be done in office under local, or does that have to be under general?
Yeah, we'll often combine that with labia minora for sort of just a comprehensive approach. And some patients are interested in that alone, but yes, that can be done in the office.
Very cool. As far as the recovery for both of those, are they pretty much the same?
Yeah.
Okay.
Yeah.
Very cool. Is there anything I haven't asked you that I don't know that you think is important?
I don't think so. It's great to be talking about it because it's just one of those things that I think the newer generations are willing to discuss these matters, but particularly older generations, it's just taboo and don't want to talk about it. So I think the biggest barrier is just knowing the procedure exists, being willing to get the information and having the courage to follow through with it. I think the other important thing is that not everybody needs this. I think there's been this proliferation of expectations based on internet, photos and pornography, and there is a wide spectrum of what is normal. So if this anatomy doesn't bother you functionally or in terms of appearance, you're probably normal. But we're even within that normal realm, we can change that anatomy if it's bothersome or not the appearance each patient necessarily wants. But I wouldn't ever tell someone who's in a normal spectrum that they need this operation.
Right. And I've seen patients young, because it is a very functional issue, like as young as 15, 16, that are athletes that it really, really is painful. And I've seen, old. So, I mean, the range is huge. And I think it's just getting the word out that, one, it's very common, because I feel like people are insecure and they just feel like alone in it. And it's like, we daily see patients come in for this, daily. Before and afters are incredible. I mean, the results are incredible. It's under local. It's low risk as far as surgery procedures go. Recovery is easy. So if it is something that's bothering you, just fix it.
Absolutely.
Like change it. It's something you deal with every day. Like make it go away. It's not that hard to do.
That's right.
Do you guys have any questions about it? Because I know you're more
No, just being able to like see Dr. D in his element doing it. I mean, the results are beautiful. The patient experience, the patients are like, they're talking. Dr. Donaldson is asking questions about like what they're doing over the weekend. Like, I mean, it's so easy.
Yeah.
And they leave and they're like, this is kind of life changing. This has been bothering me for years. And now like, I'm so happy, I'm confident. That's so important, you know.
And I'll put a plug in for my partner. Some patients don't want to see a male surgeon for this type of procedure. So Dr. Seifert is a fantastic surgeon. We have the exact same technique. And she does a really great job. I've referred friends and family who don't necessarily want me to be their surgeon, and she's taking wonderful care of them, and it's a joyful process.
I'm glad you said that because you couldn't be more right. Because there are a lot of women that would like to go to a female, so that's a really great point. And we do have that option, which is amazing.
Yeah.
And Courtney's female as well to look at the internal parts.
Absolutely.
So I guess that's a great distinction. So from the surgical perspective at our office, like where's the limit on what we can fix and what we can't fix? Like,
so
because a lot of women will want in like surgery in the vaginal wall area or whatever.
Sure. So some patients come in wanting vaginoplasty or vaginal surgery or vaginal tightening, and we make the distinction as plastic surgeons that the external anatomy, the part that you kind of can really see visually, is the part we operate on. So reduction labiaplasty deals only with the external anatomy. Once you get into the vaginal canal, it really becomes more of a urogynecological issue, and those procedures are different, require different expertise.
I love that. Is there anything I didn't? I'm just breaking off into now, but is there anything I didn't talk about that on my list?
Thanks you guys.
Trying to memorize it.
Thanks for having me. Barge into your
we didn't think you'd want to be part of the first part. I mean, do you want to have a feeling about yeast infections, UTIs, and low libido?
I'm good. You guys
How do you treat BD?
discuss your heart's
And we're
delight.
about to get a little more
It's
crazy.
important stuff.
So
Not my area of expertise.
you're definitely
Thank
going
you.
to be part of the next 15
Thank you
minutes.
guys.
My children know what the vagina is.
absolutely.
We haven't gotten into the
I'm dying.
My boys know what a vulva is versus a vagina. And they're 7 and 5.
I love it. My so growing up, my girls knew vagina too.
Yeah.
But they were talking to somebody and they go, "Yeah, babies are from China." They heard it a little wrong.
Well,
Sounds
my
like you're
girls,
close.
when my girls were little, they used to call it your front butt. Because when you're little and you're prepubescent, it looks like a butt.
Oh
so
my
we had
gosh.
front butt and back butt. And
That
I'm
is
like, I can't let them go to, I was like, your
Yes, we
front
have to
butt is
talk.
actually a vagina. So now they're like, the front butt's a vagina and the boy front butt is a tail. I was like, oh my gosh, my kids, what are we doing? That's
That
so
is
funny.
hilarious.
The
I'm
first time
dying.
my little one, she's like, Dad's peeing out of his tail. I was like, oh my gosh. And my husband's like, and that's the cue that the door, and they were little.
It's time for privacy
He was
now.
going to the bathroom and she would like, because she was little,
Yeah.
like
So
2,
curious.
and she would like walk around and try to, and he would just like,
He'd be like,
go
"Time to
around
lock the door."
while he's peeing. Yeah,
I am
that's
dying.
amazing time.
Well, I want to touch on like some trendy things. So
Okay.
everyone, well, it's funny because like the newest thing to call it is like a yoni, or they say
Sounds like a hot dog.
I know,
It
like they
does.
say like yoni steaming, and I think
Yes,
Gwyneth
the yonis.
Paltrow and like the Kardashians do it. You're the big Kardashian girl. So
I am obsessed
They
with
talk
the
about
Kardashians.
it,
I love
which
them.
I never would expect. So I think it's
I love
hilarious. So anyway, like yoni steaming, like
Yes.
steaming in that area, is it legit? Does it help? What would it help? Like,
So I was steaming my shirt before coming.
okay,
I burned my hand.
Yeah.
okay,
That, like, it was okay. But if I burn, like, my
Yeah.
vulva or my vagina, I'm going to be pissed.
yeah.
So I do not recommend. I mean, I know historically they're saying it can help with, like, stress reduction. Historically, I believe it, like, started because people were saying the uterus was going around the body looking for moisture.
Oh,
So they were giving it.
okay.
They were using that to treat hysteria. We don't need to do,
Oh.
we have,
That's
really
why
do
it's
that.
called hysterectomy.
That's why. That's
Because it
why.
was called
No
Hysteria.
way.
That's
Oh,
the
yeah.
Yes.
Oh, I never knew that.
Yes.
The more you know.
The more you know.
Wow.
I mean, they steam, like, they put herbs in
crazy.
the water, and then you, like, I guess, squat over this, put a cloth
okay.
over you to keep
Interesting.
trapping the moisture. I mean, it's not my thing. I think it could be risky. You don't want to burn yourself.
Yeah.
I mean, to each his own, but
How about just a bath?
Maybe that. Maybe a sauna.
Are Epsom salt baths okay? Or like apple cider vinegar baths good? Because I've heard that too.
I've never done
I've heard apple cider vinegar baths like balance your pH. I heard like it balances pH.
I mean, I think the vagina just needs
just leave
water.
it alone.
Yeah. Be like
Okay.
very gentle.
Interesting.
I'm not like an advocate for steaming. I mean, if somebody can figure out a safe way, I'm a little bit apprehensive of like burns.
Okay.
It's very sensitive, especially like vaginal mucosa.
And I don't know of any literature.
There's no literature supporting it.
But
It might be more of a, and I'm not opposed to like
a
being
trendy
open-minded,
kind of-
but it's not,
Love it.
I don't think it's like necessarily a safe option.
So like a lot of women do to make the area look better aesthetically outside of labiaplasty and like surgical interventions, they'll do like bleaching, they'll do obviously like Brazilian waxing and like laser hair removal. Is there how do you guys feel about those things? I know we do waxing and hair removal at our office. We do not do bleaching. So everybody
I
knows.
would not bleach.
But
I wouldn't bleach.
I wouldn't put bleach.
Yeah.
If you can, no.
I'm just not into
If you can
bleaching.
put something
Yeah.
in that whitens your clothes, let's not put it near your vagina.
Okay, I agree.
Agree.
Like you can't even get near it and smell it without it like burning your eyes.
No,
So why
and
would you
it's-
put it near your
And
vagina?
it's normal to have like slight, different color. That's normal. Like,
Yeah.
I
And
wish
who's getting all in there talking about the color of your vagina?
it's so normal. If somebody tells you like your vagina is not the right color for me, that's like a red flag.
But
Get out of here.
I think that's what Dr. Donaldson touched on, though. It's like that unrealistic expectation
It's
based
normal.
on
Just need to shut the
Photoshop
lights
like images that you're seeing everywhere.
Why are these lights so bright anyway? When you're-
Turn them off.
But some people will have ingrown hairs frequently
Yeah.
and they'll get infections there. And then those can be an issue because sometimes when they scar, they're hyperpigmented.
Yeah.
And you can like see it in your bathing suit and stuff. And that is when I will recommend waxing or laser hair removal if they can do that.
Well, I wonder even if those dark spots, I wish we had an aesthetic provider here, but would help, like BBL would help the like hyperpigmentation in those areas too if they're
It can
scarring.
help like in the right, depending on like the
Skin color.
Fitzpatrick
Yeah.
scale.
Interesting. Okay. Good to know. What about, so another trendy thing, because obviously I did research on all this, but they're called like jade eggs or balls. And the concept of the jade is like it's a stone. So it's like very clarifying and whatever. It's organic and earth and all this stuff.
Dr. Weston loves
that
this.
you that
I
you
already know.
insert into your vagina and it helps to like strengthen it, kind of like Kegels would or like pelvic floor therapy.
You just
Is
put it
this-
in there and do nothing
and
with
you
it.
just hold it in.
Oh, you hold it.
You have to like hold
So
it
it helps
in.
you do your Kegels.
Yeah.
Is it
Yeah,
like
so it like
It's kind of like
for
biofeedback.
Kegels?
holds it in. So what's this biofeedback you guys have been talking about?
Biofeedback's just like, and you can do it a lot of different ways. I will use it for stress and anxiety too, but it's just a measurement that you can see. So an easy way to think about it would be, so I'm sports medicine. So we would, for ACL prevention, you put someone in front of a mirror and you watch them squat or you watch them like land when they're jumping and you watch for their knees to fall in. So you can have biofeedback by looking in the mirror and you can make your knees not do that. And when you have that biofeedback over and over, then you learn what it feels like and then you don't need the mirror anymore. You don't need any more biofeedback.
Gotcha.
You use it a lot in different things for sports medicine, but you can also use it for vaginal, like activation of your vaginal muscles. You can do biofeedback. And so you can get like pressure readings and stuff on how good you are at your Kegels, like holding your pee in.
I mean, I'm a huge fan of pelvic floor physical therapy.
Yeah.
I think like these therapists are so good. They're so fantastic. I mean, seeing your provider, getting a referral, I mean, they're wonderful. And then they can kind of make sure, I mean, not everybody, Kegels are not right for everybody. And these eggs are probably not right for everybody. Some people have like their pelvic floor is too tight. That can lead to other issues for pain. So seeing somebody that can assess and then give you the right treatment, I mean, I'm
A lot of people are too tight.
A lot of people are too tight. Yeah.
Because our posture is horrible.
Yeah.
How we sit is horrible.
How we're breathing.
How we work out,
and
horrible.
breathing when we're
Breathe. We hold our breath. It makes it worse.
I heard breathing with like pelvic floor therapy is huge.
Huge.
Yeah.
And like, honestly, when people are like, do you know a good pelvic floor therapist? I'm like, all of them. Nobody goes into it like haphazardly, like, I didn't know what else to go into. They love that area.
I love it. They're so good. I've experienced it. I refer to. I mean, they're so good. Yeah.
Very interesting.
Yeah.
Is there like any trends you guys have heard of or patients have talked to you about that are odd or?
No, but you asked about supplements, and I was going to say,
Okay.
so horny goat weed is what?
Horny goat weed, appropriately named.
Not
and
funny.
Yeah.
Yeah, I love it.
It's a phytoestrogen, so it can be used.
It can help with libido, right?
Correct.
Okay.
And like bone health and sometimes menstrual issues, but most people know it for libido because it's called horny gut.
Yeah. One thing I want to touch on, because I think it is important, is like any couples practicing, safe sex that don't want to have pregnancy or stuff going on. I know condoms are a huge issue for women, and like there's stuff on them, there's whatever, and it messes with pH and it can cause issues, and obviously we don't want that. So women that's really important to, like, what is like should be like a go-to for that, as far as like, do you want to stay, I don't know, like there's all different kind of types, and there's some that have spermicides on them, and there's there's whatever kind of skins, or I don't even know, there's rubber, and there's like different kinds. I don't really know, I'm not an expert on condoms, but it is important. It's stuff people use every day and all the time, and like, is there one that's like better than another? Because I know women worry about that, or it causes issues.
Right. It's the spermicide, I think, overall that's causing like the pH differences, and then sometimes like the bacterial vaginosis due to that. I don't use condoms.
I don't either.
Well, I just here because I have patients come in and talk about it, so I'm like, and I know women who have said like, oh, I don't want to because it causes so much irritation and stuff, and they're important. Like, we should be able to use them. So I didn't know if there was like a go-to or recommendation for that. What else do we want to, anything else that patients come and talk to you about?
I think it's always good to realize that most women do not have an orgasm through vaginal penetration.
Yes.
Most women need clitoral stimulation, and the clitoris and the penis both start as the same embryologic origin. And so the clitoris is not just the little thing you see. That's the same as the glands of the penis or the head of the penis. The rest of it comes down. It's big. Yeah. It comes down and then it separates. Yeah. And so that's important. So you don't want to avoid or.
And you're normal if you're not having an orgasm with penetrative sex.
Correct.
Only like 20%-ish of women are having orgasms. And the idea is, like through vaginal sex, the idea is that when they are, it's also due to the clitoris, because like Dr. Weston was saying, it's not just the part you can see, but it wraps around like the internal vaginal structures. So it's totally normal. Like most women need like clitoral tension. So
interesting. Yeah. So is the G-spot a thing? Or
the G-spot is in the anterior. It's like the front wall of the vagina, and it is the reason it's the G-spot is because there's a gland there called the Skene's gland, and that's equivalent to a prostate. And men can also get aroused with prostate stimulation.
Interesting. I wouldn't even know where a prostate on a man is, honestly.
Well, when we examine it, we go up there. We go up there.
They know.
Okay. Oh, it's that one.
Yeah.
Okay.
It's this one.
It's this one. Put the glove on, bend over, right?
Yeah.
Gotcha. Okay.
I didn't have patience.
I mean, you can lay down.
The first time I ever did a rotation and had him bent over, I was like, I'll never forget. I walked into the room. The guy, I was a fellow. I walked into the room. The guy was totally naked, bent over the thing, and I was like, okay. And I was like, okay.
He really loved that.
He didn't even have a gown on. I literally took the paper from the bed, and I was like, it's okay. I'm just gonna wrap it up. I do this laying down. Gently put your knee up.
I did not know that. That's really interesting. So do you think, obviously, like women, I think figuring out what works for them is huge. And how do you feel about like vibrators and different things to kind of figure those things out? And then like obviously communication is huge. And I think that's the intimacy factor, because if you have that intimacy, and I don't mean sex when I say intimacy, I mean intimacy from a relationship standpoint. If you can't talk to your partner about what makes you feel good or what works or doesn't work, then you shouldn't be having sex with them. You shouldn't. So it's like, I think kind of that whole combo. And I know you guys have opinions on that. So how do you feel about those things? What do you say to your patients?
Yeah.
I know you talk about it.
Of course. Yeah. And I mean, I think I think that there's a place for it.
Right.
I think that, I have some patients that have a lot of trouble having orgasms, whether that be like an anorgasmia situation. And I think getting to know your own body, getting to know what feels good for you is the first place to start. And then you can start bringing in your partner. So sometimes it's like a little bit of homework could be like, like, first of all, look at yourself in a mirror. This is what your anatomy is. This is what we're looking at. This is like where you should maybe focus your attention. And then sometimes a vibrator can be helpful there. I mean, there are studies that show that sometimes that can be tricky because then it can cause like somebody to maybe rely on something like that. So that can be a little bit tricky. You know, kind of from more of a psychological place, not a physiological place.
Right.
And I think looking at like, I mean, and I know you go deep with patients when you're talking about these things, but like shame, how you were raised, religious things, like relationship issues, those are really important and they're not talked about as much as they need to be.
And I think unrealistic expectations because of Hollywood and social media and like, you know, we mentioned pornography, hate to say it, it's so prevalent. It's not real. Right. That's real. And I think men have those expectations of what it's going to be like. And so do women because they want it to be that way for the person they're with. And it's just like, that doesn't work. That's not reality.
Right.
And I think that's just really important to understand. And I've been holding a vagina in my lap the entire time.
So thanks for it.
That we didn't even use.
Right.
So it was completely needless. So there we go. We'll just set that there so it wasn't a waste to sit in my lap all day. What is this, by the way?
It's your ovary.
Oh,
Yeah,
I'm
you
used to
flip into
seeing
the
two.
ovary.
I'm used to seeing two.
It's cut in half.
Gosh. Oh, yeah. You're right. I didn't realize it was cut this way. I thought it was okay.
I feel like the most important thing is to just talk to your provider. Bring it up. You're not alone. It's not only you. And if you have a provider that you're not comfortable enough to bring it up, or if they make you feel bad about bringing it up, or they tell you to just have a glass of wine or something, you need to find another provider. And we didn't talk about like the nervous system and how that is important for arousal, like the different parts of the nervous system. If you cannot relax, like you're not going to be able to get aroused. And that's same for men and women. That's just how we're wired neurologically. So we need to have open conversations with our providers.
And I agree. And that's why I think functional medicine is huge because I mean, I've gone to PCPs and it's like, oh, you're having a problem. And they would just prescribe me a pill and they don't get to the root cause. And I think finding out, is it testosterone? Do you need DHA? Do you need hormone replacement therapy? Do you need, there's a million options to go through. And that's through really comprehensive testing that you just don't get at your PCP. And that's why I think functional medicine is where it's at.
We work with, it's not either or. Like it's not PCP or functional. We want to work with your PCP to kind of fill in the gaps together.
Yeah, 1,000,000%.
And we mentioned testosterone with libido, but we failed to mention estrogen. So estradiol is huge for libido too. Everyone thinks testosterone, but
estrogen is huge too.
I love it. Well, I want to thank you both for being here. You're amazing. And I want to thank 3 Pillars at Evans Farms for hosting us in this amazing model home. I don't want to leave. I don't want to leave, and I don't want to go home because I'm really depressed on how my home looks currently. But thank you guys for being here. It's a really important topic. It can be a little awkward to talk about, but thank you, Dr. Donaldson, for being here as well. I know you're not in the building anymore, but we appreciate your expertise, and thank you for listening. Come see us. We have a lot of great people that can help you. So until next time.
Cheers.
Cheers. Cheers. And you have 2. We got to do the other one. I still don't know why you have 2, by the way.